Hello, my name is Sharon Cohan. I'm a licensed clinical social worker and I work with the Leukemia and Lymphoma Society. I've worked with them for 17 years, so I'm specialized in the knowledge of blood cancers. I have over 40 years experience working in the oncology field. So today I'm going to talk about caregiving. And No ALL had recently done a survey, and what came back is that mental health is the most major burden that caregivers identified. And I'm not surprised by this. Uh, just recently, has the scientific community started really studying the effect of caregiving a cancer patient and what that entails and what impact that has on the person doing the caregiving. Acute lymphoblastic leukemia is a deadly disease. It comes on very quickly. It requires 10 treatment, and this treatment can last over several years, 2 to 3 years minimum. Because it comes on quickly, it's usually the caregiver that first starts noticing that their loved one is not, feeling too well. They may be having some flu-like symptoms, and they said, "Let's go to the doctor. Let's check this out." They don't expect they're gonna get a call and say, "Oh, this looks like your loved one has leukemia. You need to go to the hospital immediately." Now, leukemia affects people across the span. It can start when someone's born, or it can affect a person in very old age. So a caregiver can be maybe a spouse or partner, could be an adult child taking care of a aging parent, or be a parent of a young child. When this diagnosis comes, the caregiver is immediately thrown in to a very hectic situation. There's hospitalization. They're surrounded by medical terms and medical personnel. And the first response is to go into shock. It doesn't seem real. They don't really hear what's being said other than your loved one has leukemia. It it takes a while for them to digest exactly what's going on, and there's an immediate fear that their loved one could die. So at the beginning, they're surrounded by loved ones. They've got a full medical staff, but eventually, as the treatment goes on, loved ones and friends aren't there. They start going on with their own lives, and the caregiver can feel sort of abandoned and isolated. So let's talk about how this stress of having a loved one diagnosed with a serious illness impacts the caregiver. So I've already mentioned they go into shock. They go into grief and to fear that their loved one may be may die. And that fear continues throughout the treatment. So now the caregiver has to start learning complex skill. They have to coordinate the care of their loved one. They have to learn how to do symptom management. They have to learn how to administer the medicine and provide direct patient care. And they have to do all this while maintaining their other role. Before their loved one got sick, they were a spouse taking care of the rest of the family, preparing meals, making sure all the kids are doing well. Or they could have been a husband who is maintaining work and trying to keep the household in repair or the car in repair. So these dual roles, caregiver of the sick one and caring for the family can conflict some time and cause some stress. You couple that with the financial stress of having a loved one being treated for leukemia. There's medical costs. There could be loss of income from missing time at work. There's many times there's travel costs, treatments not available close to home. Um, and there's also continually costs of your basic cost of living, housing and food cost. All that coupled together is a major source of distress. So the immediate psychological response is this shock and numbness. But as this treatment goes on, the stress doesn't go away. There's different phases of treatment. You've got the induction, which is right at the beginning, long hospitalization, time away from the rest of the family. There's a maintenance, which consolidation, and then maintenance, which also requires some hospitalization of their loved one and being there in the hospital with them. And then it goes into a long period of continual treatment. Now, at these different points of the treatment, there's different levels of stress. Okay, can we get through the induction? Can we get them into remission? Oh my goodness, they're not in remission. We have to start off some new treatment. In between all that, infections can happen, rehospitalizations can happen, and eventually they may need a stem cell or bone marrow transplant, which is another high point level of stress. So beside the shock, emotional numbness, the sense of unreality, as treatment goes on, the caregiver becomes hypervigilant. Um, they may develop a an increased startle response. They may find that they're having really a difficult time concentrating. They may have trouble sleeping. They themselves may start having depression. Consider all these things lasting for over 2 years. Psychologists are starting to realize that there are some people that continue having this stress even after treatment ended. We call it a traumatic response that can lead to a post-traumatic trauma. And I want to talk a little bit about a post-traumatic trauma. Research has shown that after treatment, 20% of patients may experience post-traumatic trauma, while 30% of caregivers do. So that tells me that witnessing a loved one suffer and go through treatment and carry this stress for over a long time impacts one's mental health. There are ways to lower a risk of a caregiver's post-traumatic stress. One is having good social support. Now, I talked about the family and friends all rallying at the beginning. Now, if there's a way of somehow organizing all all your social support, letting them know at the beginning, "Hey, this isn't a short-term thing. I'm gonna need some of you 6 months from now, a year from now, 2 years from now," and maybe even divide up your support system to take over different periods of time. Another thing that would happen is to be able to have really clear information at all those different treatment highlights throughout the cancer journey. A caregiver will need to hear information at least 3 to 4 times at the beginning before the information starts sinking in. They have to learn a whole new language, the medical language, and they need good, clear information at their level of understanding to help them. Having an open relationship with their healthcare providers can also help with this. And the healthcare provider can provide that clear education throughout the treatment journey. Another thing caregivers could do is to practice, good self-care. One of those ways is establishing boundaries, letting people know what you're capable of and what you really need their help with. Um, Also defining the role between you and your loved one. Who's going to gather the information? Who's going to make those medical decisions? And how can you best be a support to the loved one? As an adult child taking care of a parent may not want you as their caregiver having full access to the medical information. In their mind, they're the parent, it's their role to take care of you, and they don't wanna scare you, and they don't want to be a burden. As a spouse, it's also, difficult to negotiate those roles. It's important to seek support, continually to ask for help. That's why it's important to try to space out your friends to take portions of time to be there for you. Another thing that you could do is to learn and practice what we call mindfulness. This would be learning to do deep breathing exercises, um, maybe take some yoga classes, um, and learn to keep yourself in the present because it's only in the present that we have any control. Educating yourself is also very important. Learning about the disease, learning about the treatment. An informed caregiver can make better choices, and by knowing the information, you can lessen your stress. It's very important to take breaks. Minimum of 20 minutes a day should be yours alone. And those 20 minutes a day, going outside, looking at nature, listening to the birds, maybe even if you're in the hospital room, listening to a favorite piece of music. It's really important to take those mental and physical breaks. Taking walks, keeping physical active is very, very important. Also monitoring your own emotional state. As a caregiver, you're so focused on your loved one. How are they feeling? Are they afraid? Are they coping well? Well, those are important questions to also ask yourself. And it's important when you realize that you're at your wit's end, you're not sleeping, you're not eating, and you're totally stressed out. It's time to ask for help. Professional caregivers, healthcare professionals can help you, provide active listening, help you problem solve. A good friend who's not going to try to fix it, that can sit there and just listen to your concerns can be helpful. And also finding safe places where you can be yourself and allow yourself to feel the emotions that you're going to feel. But there are benefits to being a caregiver. And I want to end this by letting you know that it's not all bad. Some of the benefits of being a caregiver for somebody with leukemia is that you develop closer relationships with others, including partners and children. You gain a greater appreciation of life. You've learned how to prioritize um, and really know what's important in life. You develop more empathy for others. Hopefully, you develop better health habits. So there are 6 domains that I've identified that are consistent in caregivers. Um, and those are the ability to accept things as they are, be empathetic, have appreciation for the smaller things of life, stronger relationship with families. You've developed a more positive self view. Oh my God, look what I've done. Look what we've gotten through. If we can get through this, we can get through anything. And you've learned to reprioritize. So please know as a caregiver, your role is important. Your role is difficult. And it's important to take care of yourself. If you find that you may be having ongoing depression, you may be having nightmares, um, even after your loved one has finished treatment, please seek mental health help. Please talk to a spiritual advisor, a mental health counselor. You don't need to suffer. There is help out there. Thank you.